As in all areas of our lives, it is very appropriate and wise to look ahead and to contemplate what's happening and may likely happen in the year ahead. I've been encouraging our Stand in the Gap Today listeners, however, to follow this practice every day. You know, Proverbs 22 verse 3 says that the wise man foresees danger and hides himself, but the simple or the foolish just simply go on and suffer for it. Now, looking ahead anticipates such things as, for instance, potential unconstitutional laws and those government regulations that could impinge upon our God-given rights, or the impact of an increasing cultural general disregard for law and morality that we see around us, or a judicial system ruling in opposition to God's moral laws or ignoring God's judgment on our nation for our sin and idolatry. You see, the point is, there are many broad areas for which we need to look ahead and consider. But there are also personal issues too, like our finances or our children and marriage, our relationship to God, certainly, or such things as decisions relating to our health. The wise man principle applies to these as well. The wise look ahead. The prudent considers as best that he can what's coming, and with the wisdom of God considers where danger lurks and makes adjustments accordingly. The foolish, the simple, the ignorant just plunge ahead and suffer the consequences. Now, what I just shared is the biblical foundation for individual responsibility toward what is ahead. But it is, of course, what every person in authority should do as well, be they parents, employers, elected leaders, and of course, pastors as shepherds of the flock of God. Because the area of healthcare and healthcare freedom touches all of our lives, Isaac and I, along with Twila Brase, president and co-founder of Citizens Council for Health Freedom, the leading protector of health freedom, I believe, in the country, and also a monthly guest on our Stand in the Gap Today radio program as well. Together, we're going to look ahead in regard to health freedom issues and the dangers that lie ahead. The title I've chosen to frame today's program and next week in part 2 is 2024 Health Freedom Trends, Vigilance Required. Now, in today's program, we're going to consider the broader outlook for the consideration and identify the hostile trends. Next week in part 2, we'll identify the encouraging trends and how to, in light of what's anticipated, to best prepare and to be appropriately proactive. And with that, I welcome to the program right now Twila Brase. Twila, thank you for being back with us on the program. It's a real honor to have you today here with Isaac and I.
Well, it is always great to be with you, Sam, always.
Twila, let's get right into this because we could spend hours, which we don't have an hour. This is a short program. But as you look ahead to health freedom trends, that's what we're talking about, trends, things that are happening that are going into next year. I'm going to ask you this in this regard. Because so much of our health care issues are controlled by government or government policy, that involves a lot of things. And I'm going to ask you this. On a scale of 1 to 10, being where 10 being maximum danger, 1 being maximum freedom, where do you think government policy is taking us right now in America? Where would you put us on that scale? 10, danger, flashing, 1, safety, freedom.
So at the federal level, I would say that we're in danger with a number 10. Although I do say that some of the states are really starting to move, and we're seeing things that look really positive. And so in that case, we're seeing some 1s and 2s, as well as in private initiatives. There's definitely a 1 there of real freedom happening with private initiatives.
Okay, and that's going to be definitely a part of next week's program. We're going to talk about that because that's some good news. We got about a minute in the segment before we break. But let me ask you this question, just in simple terms. Why is it that when government gets involved in healthcare decisions, that it tends to complication and a limiting of individual health freedom? Why is that, in simple terms?
So we are all unique individuals, and when government acts, it acts as a big monolithic policy-making machine, as though we were all, standardized. And so it does one thing and it says it for all 300 and some million people. And that's why, it's a danger for government to be involved in anything that happens in the exam room or at the bedside, because it's not you that the government is looking at. They're just looking at the population, not the person.
Sounds to me, I was in government, as you know, for many, many years. It's kind of like, so one size fits all doesn't fit all very well, does it? So, ladies and gentlemen, stay with us. We'll be back in just a moment. Our theme today is on healthcare, and we're going to get into the issue of dangers that are lurking that we can see in this year ahead, and we're going to come back with some responses that you can take as well.
Welcome back to Stand in the Gap, and today as we talk about the biblical principle of looking ahead and being vigilant about what is coming our way as we seek to walk in the will of the Lord and walk biblically with a biblical worldview. We're talking with a longtime friend and a regular guest on our radio program, Twila Brase. And Twila, we're looking at health freedom trends, which is something that you talk about with us, you and Sam especially, on a regular basis on Stand in the Gap Today radio program. And one of the things that you've talked about on that program that I think every one of us watching today can really relate to is a national trend that is developing, I think, even more, and that is a shortage of nurses. And I think other, similar occupations in that field, but especially a shortage of nurses. And so would like to have you comment about how serious this shortage is or is becoming, and also how it came about. How did we get to this position where this is becoming a problem?
Yes, so there has been a trend toward a shortage of nurses for some time, but once COVID began, they were heroes, right? And then when they wouldn't take the shot, then they were zeros, as they say. And a lot of nurses started to leave the field because they didn't want the shot. They'd seen all sorts of injury from the shot. And so a study came out that says that 100,000 nurses left in 2021. So they quit. And they may be in other positions, but they're not at the hospital and they're not in the clinics. And the shocking thing about this is that they are younger nurses, not older nurses. So they expect nurses to leave when, they start hitting the age 50. But these are nurses that are younger and they have headed, they have left. I think another thing that's with that is just a different mindset in the younger people these days, a completely different mindset that may be hampering them staying in the profession.
So that's interesting, and I know of a number of different nurses. Some are family members, friends, people I know through churches and things that are walking through this. And I think there's some very obvious things when you're trying to line up to go to a doctor's office or different things, if there's not enough nurses to help facilitate, the obvious things. But we're talking today about looking ahead at health freedom, and that's what you really do. You're kind of a watchdog there for health freedom issues and trends. When it comes to health freedom, what kind of things, some of these might be obvious, but some of them might not be so obvious to some of us normal, just onlookers. What are some of the things that are a threat to our personal health freedom as a result of this shortage of nurses?
Well, I'm a registered nurse. I used to work in a children's emergency room, and I know that if you don't have nurses, there aren't enough doctors to take care of people. You actually have to have nurses who are watching the patient regularly, and if you don't have that, then you really have a lot of patients who are left alone for a longer period of time than they should be left alone in whatever the setting is. Typically not a clinic, but it still can be a clinic. But even in like rehab facilities or in the hospitals where the patient's trying to get the attention of a nurse and nobody comes. And that actually happened to a congresswoman just recently. She died on December 31st, but she shouldn't have died because she had surgery and of her spine, and then she was sent to a rehab, and then she had fecal material and it got into her wound, and she sat there for an hour and nobody came. And then they tried to do surgery to heal the infection and it didn't work, and they put her in hospice and she died. And so, this is what happens when there aren't enough people who are actually available to take care of those who need them.
And Twila, you're right. We could go much further on that, but I think our viewers have probably been in the hospital themselves in the last couple of years, or known somebody who has and can say, yep, exactly, I can see that. So we'll just let that there. But that's one area of danger that is developing. Another one, Twila, you and I have talked about, and you've talked a lot about it, and it would involve probably many of our viewers. They're either a part of the system, or they know somebody who is, or they're going to be a part of it, and that's what we call Medicare. You call it the Medicare trap, because a lot of people don't understand it. They think, oh man, I can't wait until I'm 65, and I can get on Medicare because then everything changes for the good. Well, not necessarily. Tell us about that.
Well, there are so many traps in Medicare, and we're actually writing a book and we're going to list them. But it's a handbook for Medicare for Americans. And but Medicare itself is a trap. So most insurance companies will not keep you on once you hit 65. And so you're forced into this program. This program is going to be insolvent in just 8 years, meaning it can only pay 89% of its bills. There's so many parts about Medicare, like if you go into Medicare Advantage, it's unlikely that you will ever get back into original Medicare. And why should you think about the two of them? Original Medicare lets you go to any doctor, any hospital, any clinic, anywhere that takes Medicare. But Medicare Advantage has networks. There's probably about 70% of the procedures you might need that you have to get prior authorization for. You don't have to have that in original Medicare. And so then if you get sick in Medicare Advantage, you might never get back into original Medicare, even though you can switch, because you might try to get a supplemental plan to help pay for the extra expenses of the deductible, the co-insurance, right? But they can do medical underwriting, and they'll look at you and they'll look at your medical records, they'll talk to your doctor, and they'll say, no, we won't accept you. So now you're on your own with all those prices. So this is one of the reasons why we say, pick original Medicare and don't pick Medicare Advantage, because if you get sick in Medicare Advantage, you might be trapped in there, and that whole network, limited network, prior authorization, limited access to care, you might be trapped in there for the rest of your life.
Twila, I think on the radio program we talked about it, and that because as we did that program, and probably for some time during this year, there's a lot of promotion, a lot of older people that are in Medicare or about to go into, they see this thing that comes through that says, wow, Medicare Advantage. Well, the immediate thought is, this is good. But you're actually defining it as really Medicare Disadvantage. So that's a big deal, isn't it?
It's a very big deal. And, they have zero premiums, but of course, they're getting a certain amount of money every month from the federal government for you, but they have all the power in the world, essentially, to ration your care. They can use medical necessity definitions, and they can keep all that money for themselves. So, that is a really big deal. Just because it's got a low price doesn't mean that you're going to ever get the care that you need or want.
All right, excellent. And again, we could go much further on this, but we're just highlighting some areas. So that's fantastic. Another one, Twila, modern medical care, without a doubt, has been substantially helped by technological advancements. But you've identified a danger that's further erupting, coming towards us, where technology is now, I'm going to say perhaps steering the ship. Some have heard of artificial intelligence. Intelligence part sounds good. Artificial, a little bit of a question for many, but that's getting involved as well. So explain how technology, you've identified technology, artificial intelligence in particular involved with it, is presenting not an advantage, but a danger for individual health freedom.
So maybe I can start out with the question of, do you want your care or your medical decisions made by a robot? Because that's what artificial intelligence is, whether you see it as a robot shape or whether it's just a computer. And that's where a lot of medicine is going. That's where AI, artificial intelligence folks, want to take it. And we're already partway there, because when they imposed the electronic health record in the exam room and in the hospital, that was imposed by government. Now there is a limited set of protocols that are listed in there. And when your doctor scrolls through the menu, looking through what he or she can give you, there are these protocols for them to pick from. They don't get to pick anything. They don't get to pick something that's new or wonderful or something creative for you. They're limited to what is on the menu. And so this is already artificial intelligence put into that electronic computer system to limit what kind of care you can get. But going even further, it's like really taking over who makes the decisions, and the doctor's just there to press the button.
All right, let's take this just a little bit further, if we can. In the perfect world of patient and physician care, a patient is sick, they go to the doctor, they expect the doctor to spend a little bit of time with them, examine their symptoms, ask them questions, compares against his knowledge and experience, and then come back and say, you know what, I've seen a lot of this over here, and then have a plan of action for what to do. What you're describing is this robot or this artificial intelligence actually taking that decision making from the doctor and saying to the doctor, this is what this thing out here says is the best thing to do, and therefore you do it. So as you say, the doctor becomes an order taker in the process. That just sounds so foreign, but it's being presented by government officials, as I've seen it, as an enhancement and an advantage. But explain that a little bit more. It's what do you lose when you lose that actual physician using his experience in relating to a patient? I mean, explain a little bit more.
The new physicians are being taught to be a different kind of physician. They're being taught to be a protocol-following physician, not a critically thinking physician. Now, there are definitely physicians who are trying to continue using their brain in the midst of getting their education and hoping that they get out and can actually use their brain to do what the patient needs to be done. But if all you have is what is in the computer and what the corporations who populate the computer, they put those protocols into the computer. What they would say is they've looked at the best of science and they put it all together and they put it into this computer, and now you pop in the symptoms of the patient and out pops this diagnosis and this treatment plan, and that should be good enough, but it's really not good enough. And if you even think about what's happening in science, and we saw it with COVID, right? There were all these competing studies and it became very political. So if you are a healthcare corporation and you want to save all the money for yourself, then what you're going to do is make sure that you have the studies that show that only X, Y, and Z can be done and not A, B, and C, which are going to be more expensive.
All right, and I think that we'll just let that is there. But you brought up the corporate aspect, and that actually is the fourth area of danger that's increasing down the road. And you've identified it as, a corporate monopoly of the medical providers, buying up doctors and surgeons and so forth. Explain that, what that is, why that's happening, and the danger it presents.
So this is because, of course, the government has gotten into healthcare and is so deeply embedded. And not only that, but they have now contracts with all of these health plans to essentially do their bidding. And that's why most of Medicaid is in a health plan, and so many people in Medicare are in a health plan, these Medicare disadvantage plans, right? And so, but there are doctors who have chosen not to sign up for them. And so the corporations that work with the government, and just corporations in general, including private equity, are looking at the healthcare system as one of the ways that they can make money. And so they're not looking at it for the patient. They're looking at it for their own agenda, whether that's making money or rationing care and saving money for the government. And so there are hospital systems, there are health plans that are buying up doctors' practices. And then there's the government that's trying to get to corral every doctor in the entire country into doing value-based medicine and getting paid, essentially a kickback, to do medicine the way the government wants them to do it. And so there's this extraordinary attempt across the country to seize control of every doctor, either by ownership, controlling them, buying the practice, and then forcing them to do whatever the computers say to do, or by giving them a bonus, a kickback, if they will do medicine the government way.
All right, and that's excellent. Ladies and gentlemen, we're going to break here, but just remember this. Centralized government is always in competition to individual freedom. That's just why, if you walk away with that, you'll understand more perfectly why what we just talked about was a danger. Stay with us. We'll be back in just a moment as we close out the program with a few thoughts of what you can do.
Welcome back to Stand in the Gap. And I'm going to go right to you, Twila. As Christians, Paul tells us in Romans 12 that we are not to be conformed to this world. We're to be transformed. Our minds are to be renewed as we seek to prove what is good and acceptable. And that's what we're talking about right now, proving what God's will is, looking ahead, saying, what can I do? And as you talk to people all over the country and you get called in to testify in different groups and meetings all over, what do you tell, especially Bible-believing Christians, but anybody who's concerned about the things we're talking about, what can we as individuals do to make a difference in our own health, especially our freedoms of health?
Yes, well, there definitely are things. One of those is just to try to change those policies by talking in particular to your state legislators, because states can reclaim their 10th Amendment rights of the people and the state, and they can actually go up against some of the things that the federal government has done, which actually violate the 10th Amendment. So talking to them, asking them to do things like health benefit plans, which some states are doing, which is closer to real insurance and it's away from the health plan. The healthcare rationing, limiting health plans. They should look at options like healthcare sharing, which are not as limited as health plans at all, and those are often Christians sharing expenses with other Christians. Go to the Wedge of Health Freedom. That's our directory of cash-based practices. Those doctors work only for you, and then build the dream of a parallel system in people's minds. Get them to realize it doesn't have to be this way. We can go back to paying for cash for care and getting cash from a real insurance company like they used to, like homeowners insurance does or car owners insurance, where they pay you cash and then you pick your doctor and hospital. So these are the kind of things you have to open your minds and be very careful when you're at the hospital and at the doctor's office. Do not just take their word. Ask them, is this the only thing that you can do because that's what the computer says you can do it? Or is there something better that should be done that is just not on the computer?
All right, Twila, I didn't know for sure how you were going to get all of that in that short time, but that was a very, very good approach, and thank you so much for being with us. We look forward to you being back with us next week on this program, where we're going to look more at some of the good trends and things that are happening, again, with what people can do. So again, thanks for being with us today, and we'll see you here this next week. But ladies and gentlemen, thank you for being with us today. Hopefully you found this to be practical and informative. But understand that good health is a blessing of God. God has given us the ability to think and to act and to think for ourselves. And that is what we are to do. And that's our principle today. Look down the road, see what's happening, and then say, now, God, give me the wisdom. Help me to make right decisions now. That's really what it comes down to. We're trying to be practical today. If you've not recently communicated to us, could I ask you to do that? Send us a note this week. Let us know that you are watching us, perhaps from where you're watching us, and how God is using this program in your life. We'll see you next week.